It's very hard, even for families who have health insurance, to access primary care physicians and pediatricians.
President Obama's deadline for a comprehensive health care package is fast approaching, and the opposition is releasing fierce criticism just as quickly.
President Obama and the Democrats in Congress are in a hurry, a reckless rush.
Launching a new ad hitting the airwaves entitled Reckless, the video takes Democrats to task on health care reform proposals. The video appeals to where Americans are particularly sensitive these days, in their pocketbooks.
Obama said he wouldn't raise taxes.
Under my plan, no family making less than $250,000 a year will see any form of tax increase.
But now won't rule it out.
He made a pledge. He said, I'm not going to raise taxes on anyone making under $250,000. Is that pledge still active?
We are going to let the process work its way through.
Republicans are not convinced that the country is able to pay for the president's proposal, and they say taxing the wealthy to do it is not wise fiscal policy.
The legislation they're proposing is far more complicated and far more expensive than what is really necessary to fix the problems that do exist.
Mr. Obama says he wants both houses of Congress to approve legislation before their August recess.
I think it was a stretch goal back in January, and clearly it's no longer a reasonable deadline.
Lawmakers still have concerns about the cost and size of the reform package. Some say the president is rushing too fast and causing needless, complicated legislation.
You can't expand something, give more, bring down the cost unless you come up with some remarkable, unique way of which to pay for it. And that is the question.
Problems in the United States healthcare system have been a major political issue for years as the cost of healthcare steadily rises.
When people go to an emergency room and they can't pay, who is picking up the tab? Those of us that have insurance.
But a popular solution on how to pay for it remains elusive.
How much will it cost? $1.6 trillion?
President Obama continues to make health care reform in the United States a top priority, even though there's some indications from lawmakers that they're in no hurry to make any major changes. However, the president plans to press those reluctant lawmakers when he addresses the nation in a primetime news conference. For Press TV, Colin Campbell, Washington.